Good evening and Happy New Year's to everyone. Dr. T here. Today we're discussing myths versus facts. We're going to start off with the myth that wearing two condoms provides more protection than wearing one. Myth. Wearing two condoms is actually less effective because the condoms create friction against one another and are more likely to tear. When they tear, of course, the ejaculate, the semen, will seep through and defeat the whole purpose of wearing the condom at all. And let's be honest, if you're concerned with contracting an STD that you need to wear two condoms, you probably should not be having sex with that individual. It's actually safer to masturbate. Myth number two. If you have sex during a woman's menstrual cycle, then she cannot get pregnant. This is a myth because you don't know exactly when she will be ovulating. And semen can live in the vagina in ideal conditions from 5 to 7 days. So let's say your significant other ovulates right after her menstrual cycle, and you have sex with her the day before her cycle is due to end. I assure you, there is a high chance of her being able to conceive. Of course, there are the factors of the health of the sperm, but nonetheless, don't think that she can't get pregnant because she's on her cycle. Okay, I'm getting a question. All right, so yes, the flow of the menstrual cycle can help to evacuate the semen, but it can only help. There's no guarantee that it will all be flushed out, and you're still at risk of pregnancy. And douching as well. So, just a quick side note, I do not encourage douching. It will throw off your pH. You'll be inclined to get yeast and BV infections. If you're going to, or if you really feel the need to, you should probably do so with spring water. Nonetheless, if you're trying to avoid getting pregnant, douching is not going to work. Sorry, that's just not the way it works. All right, myth number three. Women ovulate once a month. Scientifically, women are known to ovulate 1 to 3 times a month. There are circumstances that affect, of course, a woman's ovulation. So, of course, if you're going through, say, IVF, then your hormones are going to be fluctuating more. Your estrogen is going to be higher, your progesterone is going to be higher. Um, but even if you're not, you can experience something called hyperovulation. And that is when a woman releases an egg within 24 to 48 hours, um, and it can be more than one egg. So, statistically, women of color actually experience this hyperovulation more frequently than other women. And this is more specific to African American women. If you're looking for any information regarding this, I encourage you to seek information from scientific journals. Don't just put it in Google and expect for everything or all of the information you find to be valid. All right, and the next myth. If a woman is pregnant with twins, then there's only one man responsible for the pregnancy. Now, this actually ties into the previous myth. There are a lot of things to consider, um, specifically the egg health and the health of the sperm. So, we're going to start with differentiating between identical and fraternal twins. Identical twins come from one egg that is released. So when that one egg is released, it splits into two. And because it's of the same egg, that's why you have identical twins. Fraternal twins actually come from two separate eggs. So that's when a woman releases two eggs and both of the eggs are fertilized. Now, I want you to keep in mind that, and I need men and women both to listen to this. If a woman releases two eggs within 24 to 48 hours and she has more than one partner, those eggs can separately be fertilized by each man individually, which will result in her having fraternal twins with two different fathers. People are under the impression that that only happens to cats, but I am here to tell you that is not so. And unfortunately, you will not know until you have a DNA test. On to our next myth. Sperm dies when it hits the air. I have no idea where this came from. It is not true. Again, I'm going to repeat, it depends on the health of the sperm. However, your healthiest sperm can live up to 30 minutes outside of the vagina. As I previously stated, internally in a woman's vagina, healthy sperm can live up to 5 to 7 days. 5 to 7 days. I need you to remember that. So, when we're talking about the health of the sperm, we're actually talking about three separate things. Okay, so let me break this down for you just a little bit. Ejaculate or cum in layman's terms is actually semen. Semen contains sperm. Sperm itself is notated to have a count. That's the amount of, we'll say, swimmers that are able to fertilize an egg. Also, there's motility and morphology. The motility is discussing the ability of the sperm to move, to reach the egg, and the morphology is discussing or defining the shape. All of those must be within a normal range in order to fertilize an egg. So it's very important information that I need you to know. And lastly, the infamous pullout. I've heard this many a times. Well, Dr. T, I pulled out and somehow or another she still got pregnant. That is because the myth that pulling out cannot get a woman pregnant is just that it's a myth. There is something called pre-ejaculate, which in layman's terms is called pre-cum. When a man is aroused, it is released and it can also contain active sperm. When you're having sex prior to the man actually ejaculating, this is released on a continuum, which means you're releasing sperm into the vagina. So, regardless if you ejaculate or not, or you pulled out before you ejaculated, you have still made deposits of sperm into the vagina. Now, I would like to add, men, I understand that there's a stigma with having fertility issues, but there are many of you having issues just as women do. So I encourage you, if you're having issues and you're concerned with confidentiality, by all means, reach out. Send a message, place a call. If you've been told that your count or your motility or morphology is not within the normal range, I can assist you to get that within the normal range within 30 to 60 days without any man-made hormones. If you're having any issues getting or maintaining an erection, I can help you with that as well. So that concludes our myths versus facts for today. Don't forget to like and subscribe, and I'll see you next time.